Hey, deserving listeners, couples therapy, let's watch. My name is Dr. Kirk Honda. I'm a therapist and a professor, and I specialize in couple therapy, and I have been teaching students how to do couple therapy for the past 3 decades. And I took a poll, and the next couple on the list is Molly and Josh from season 3A. So let's watch.
So we talk about everything.
Everything. It's a waste if we don't, for us.
Okay, so they're checking in before going into the first session, it looks like. And I'm assuming that's Josh. And he's saying, so we talk about anything? And she's like, yeah, anything. Otherwise, it's a waste of time. And he's like, okay. This is a complicated topic. Of course, it does help to be honest, but you don't have to be completely honest all the time. I mean, I don't recommend lying, but you don't have to tell your therapist everything. That's a bit of a myth. For therapy to work, it really just depends on what you're going into therapy for. It depends on the topic at hand in the session. So it's really case-by-case basis. But generally speaking, yeah, you don't want to hold back because then you're not at least giving the therapist the full picture, but you're also not communicating openly and honestly with each other.
Josh and I are...
Now, I'm also wondering if he's worried about something being revealed. Now, of course, they're not really in therapy because they're being filmed the whole time, so that would be another conversation that I would hope they would all have. To say, like, so are you fine with talking about this topic and this topic? Because this is going to be out there literally for the entire population of the world to see for eternity. So is that cool? They should all have that conversation for sure.
It's such an interesting place in our marriage.
Okay, so we're seeing 19 years they've been in a relationship.
Josh and I are at such an interesting place in our marriage. We've kind of done everything to each other or experienced everything in a marriage or a relationship that you could to try and break it up.
Okay, I would imagine that probably means cheating, fighting, separating, big conflict, threatening divorce, starting the divorce process. I don't know. Let's see what she says.
We are still here.
Okay.
I feel like we're at a place where we're kind of done doing all of those things.
But all of those things
all the things we could do to somehow
test.
test. Yes, that's the perfect word, to test. So we're here, but we did all that test.
Okay, so the therapist, Orna, she introduces that word test, and the wife says, yeah, test. That's a perfect word. I don't know what that indicates. It could mean a lot of different things. I'm wondering if it means that attachment insecurity is at play, and one of the ways that anxiously attached people, and even avoidantly attached, any insecure attached individual, they are more insecure. They're more worried about rejection when there aren't any signs of it, and will try to resolve that anxiety by finding out, am I actually being rejected, or am I at risk of being rejected? And one of the ways that they will do that is through testing.
Yeah.
Do you want to?
No, I'm just feeling so nervous. I just feel a little nervous.
Nervous sitting here?
Yeah.
But maybe say more specifically nervous about...
I think you're afraid of me, A. And B, I think what you were just about to say.
I think I'm afraid of... I think I get scared by what the truth might
B.
be.
Okay, so he is saying he's nervous, and that's a good sign that instead of doing something squirrely, like getting hostile or shutting down, which people will do when they're nervous, instead, he just admits it. I'm nervous. I'm nervous about, and then he's asked by Orna, which is a good question to ask, what are you worried about? And he says, I'm worried about the truth. So this is another example of him, because when they were coming in the lobby, he was talking about the truth. So I wonder what this is getting at.
And cause to happen. Like the
Consequences.
The consequence.
How do you mean that?
Both of us have had infidelities, and...
Right. That's what I was thinking that she was referring to, at least in part, when she was saying we've both done everything to test or to try to break up, but we're still together.
I think there's a lot of anger still.
Yeah.
Say more about that.
Okay, so considering that he was saying that he's nervous about the truth and that she follows it up with the infidelity that they've both committed, that is possibly what he was referring to in the lobby. And yeah, infidelity will always do a number on a relationship. You can recover, but you never fully recover from that. You can recover quite elegantly and functionally in a healthy way, but there will always be triggers. And what research shows is that the couple, and particularly the perpetrator of the infidelity, the cheating partner, they will report 10, 20 years later, even after recovery, that they never predicted, they never would have thought that 20 years later, the infidelity would still be producing pain in the other person, that their partner would still be hurt and scared at times, triggered. And it's something that everyone needs to understand. I mean, I think most people understand that cheating can hurt the partner, but what research shows is on average, people have no idea how much it will hurt.
I think I'm waiting for Josh to openly discuss the pain, whatever emotions he has around it for himself.
I think I have felt like, okay, well, now that stuff is in our past, so...
Okay, just some observations. Molly is talking for Josh at times. Sometimes therapists will overfocus on that, particularly in the first session. I say that because when people come into the first session, particularly if one person is, both people are nervous. It's inevitable. There's getting to know each other. You don't know where to start. You don't know if it's going to explode. You don't know how the therapist is going to feel about you. You don't trust the therapist. So, there's nerves. And some behaviors can be a little wonky, can be a little exaggerated. But I am observing that she is talking for him at times, not pathologically. He is hesitant with his words, at least in this moment. He takes a lot of pauses, which is fine, but he's a little slower. She's a little quicker. Just an observation. The other thing is that she is saying that their current issue, or one of the fundamental problems currently in their relationship, is that she cheated and he is still having feelings about it.
We're not supposed to talk about it anymore. And so I think that's...
Because...
honestly, I think it's my worry about getting her upset.
I don't like that answer.
Okay, so he's saying we're not supposed to talk about it anymore. Is that because she shut it down in the past? Is that because they agreed, or he just interpreted, or something? It kind of sounds like the latter, because she's saying, I don't know if I really like that. And if she didn't want to talk about it, she wouldn't go to couples therapy. And she also wouldn't in the lobby say, no, we're supposed to talk about everything. So it's starting to all come together in the lobby. He's like, so we talk about everything? So maybe he's misinterpreting her, or they have had some big blow-ups. It's almost universal that couples have a very difficult time recovering from infidelity in a functional way. Sometimes couples without therapy, without a specialist, can recover kind of or enough, but it's usually because they are suppressing, which can work over time. Time heals to some extent. But in my experience, all couples benefit. It's one of those few things that really needs a therapist that knows what they're doing to help a couple recover from.
Make her feel better?
Right.
Is it the truth? I don't know if it's the truth. Maybe
Right,
it is.
it becomes then difficult to know what's going on.
If it's going to make
yeah.
her feel better, then maybe I should just say that thing.
No, I don't want to do this anymore.
Right.
I don't want to make him feel like he's being masked, or like he can't speak his truth.
Right.
Okay. I'm guessing I'll get more data down the line. That's one of the benefits of watching this reality TV show as opposed to 90 Day Fiancé or Love is Blind, in that I can depend on the format and Orna to drill down. Just think about all the questions that we would love to have asked some of these reality TV cast members, how the host of the reunions get blasted for not asking certain questions. Well, this show has all those questions and more, right? But I am hearing at least there's a possibility that she would shut things down. She would get angry. She would put him in a position where he would have to mask, as she is saying, as if everything's fine when it's not.
I would like to know finally how angry he is. Mm-hmm. But there's also a part of me that worries if he actually allows himself to say what he really thinks, that it might be something that would make him actually really look and realize that he doesn't want to be married to me.
All right, let's take a break here for now. The rest of this video will be for members of the YouTube channel. So if you want to watch this and the rest of these reaction videos to couples therapy, become a member of the YouTube channel. Otherwise, please take care of yourself because you deserve it. You really, really do.